Hi everyone, I hope you enjoyed the break. Did you eat the brigadeiros? They were amazing. So, my name is Jessica Magier. I am a Stanford LLM student and a content team member here at Brazil at Silicon Valley. We will now kick off the AI in Brazil section, starting with an amazing company called Huna. It's the healthcare showcase. We'll hear from Daniella Castro, who will talk about her company. Daniella is the co-founder and CTO of Huna, a Brazilian deep tech company at the forefront of using AI for accessible cancer screening. She has been honored with 5 awards, including the prestigious Bayer Foundation's Empowering Women Award. Her career began at Petrobras, and she has later played a key role in establishing one of Brazil's pioneer AI research labs. Daniella has over 20 scientific publications and holds a master's degree from the University of São Paulo, as well as a PhD in artificial intelligence at the Federal University of Minas Gerais. Please welcome to the stage, Daniella Castro.
Hi, I'm so excited to be here to talk about how we can transform routine, very cheap blood tests into powerful tools for cancer risk assessment. And we are all here envisioning the future, but let's go back to the past a little bit. About a century ago, a scientist called Alexander Fleming returns to his lab after a short vacation and finds a contaminated petri dish. But instead of discarding it, he noticed something remarkable. Where mold had grown, bacteria couldn't survive. And his accidental discovery of penicillin would become the world's first antibiotic, revolutionizing medicine and saving millions of lives. And today, we stand on the brink of a new revolution in healthcare, this time not driven by chance, but by the deliberate use of artificial intelligence. And just like the penicillin opened the door to fighting infections that were once considered unbeatable, we are now recognizing that the fight against chronic diseases requires a shift in our approach. So, quoting Dr. Peter Attia, one of the main experts in the field of longevity, it is absurd and harmful to treat chronic diseases like a broken bone, where you either have it or you don't. It's not binary. What he means, in other words, is that the one-size-fits-all approach that we are used to is too simple for the complexity of chronic diseases. And to unveil this complexity, we need artificial intelligence. And we at Huna have been pioneering the use of artificial intelligence to address medical problems for over 7 years. We have 14 published papers in renowned scientific magazines. We have 3 field patents, and we have been recognized with 4 awards, including the esteemed Women Empowerment Award from Bayer Foundation. And during this journey, we have worked with multiple medical specialties, and also with different types of data, for example, magnetic resonance imaging, X-rays, and blood data. And it was then when realized how our blood tests are still underutilized given its immense potential. We tend to simplify our blood markers into fixed values. So, for example, when checking our blood results, we hope that our blood sugar or our glucose levels are under 100. It's like if it's 99, everything's fine. But suddenly, if it's 101, then you have a huge problem. And the thing is that chronic diseases, they have inherent biological processes that are complex, that are nonlinear. So why should their signals in our blood be any different? And to explain what it means to identify nonlinear patterns in our blood, I will give a very simple and fictional example. So let's envision a scenario where we want to differentiate between people who have a disease and people who do not have this disease. And we want to do so by measuring a routine biomarker, the glucose, our blood sugar. And as we can see, patients that are sick generally have elevated values of glucose. In this fictional example, just to be clear. And if we establish a linear cutoff here, for example, I would say that everyone who have glucose levels over 100 is sick. Then I can identify correctly 90% of the sick people. However, I will say that about 40% of the people who are healthy are sick. They will be false positives. But if I take this population that have glucose level over 100 and measure another biomarker of them, for example, the C-reactive protein, I may observe a different pattern. So here we can see that sick people also generally have elevated values of C-reactive protein. And I can establish a linear cutoff here at 10. And these two biomarkers together make it possible for me to draft a very simple decision tree. So if the glucose level is under 100, I will say that this person is healthy. But if it is over 100, then I will measure his C-reactive protein. And only if it is above 10, then I will say that this person is sick. And by joining these two biomarkers together in this simple decision tree, our specificity grows from 60 to 80%, meaning that we will have 50% less false positives. And of course, this example was oversimplified, but you can picture if we have more interacting biomarkers and also use a more sophisticated AI algorithm. And that's basically what we do at HUNA. Through artificial intelligence, we repurpose routine blood tests to identify signatures of cancers. And by signature, I mean the patterns that that this disease leave in our blood markers. And worldwide, we are not alone. There are many companies that are using artificial intelligence to increase the power of blood markers. For example, Insight Tracker uses our blood biomarkers to suggest ideal levels and also how to get there, mostly to help with longevity. Grail and Freenome are both American companies that use very specific biomarkers called cell-free DNA to find tumor traces in our blood. And their methodology is very accurate. It helps with diagnosis. It's even called liquid biopsies. However, their tests, because they look for this so specific biomarker, are very expensive. They cost about $1,000. On the other hand, there is an Israeli company called EarlySign that has partnered with the pharmaceutical Roche to build a tool for lung cancer screening. They use routine biomarkers, demographic, and clinical data. And their tool is much cheaper than Grail and Freenome, but they tackle a different problem, not diagnosis, but cancer screening. And of course, we at HUNA, we are using artificial intelligence to unlock the power of blood biomarkers in very, very routine and cheap blood tests. For example, the complete blood test that costs about $2 in Brazil. And you may ask, why us? Well, we're not just tech nerds. We are also biomedical experts, because we have a team of scientific advisors that are composed of oncologists, radiologists, pharmacists specialized in blood analysis, and so on. And we also have exclusive access to very representative databases through our partnerships with very important health players in Brazil, such as Grupo Fleury, one of the largest laboratory chains in Brazil, and also Hospital do Amor, the biggest public hospital focused in oncology. And plus, our potential audience is pretty broad. Basically anyone with blood, right? And our first product focuses in breast cancer. Well, breast cancer is a major health issue everywhere in the world. And when we look at developing countries, like Brazil, almost 80% of women lack access to regular mammographic screening. And these women are usually diagnosed in later stages, where their mortality rate is much higher, and plus their treatments cost up to 10 times more than an early stage diagnosis. To train our algorithm, we have acquired the largest published dataset in the world from our knowledge, and it has almost 500,000 women with their CBCs, their complete blood counts, labeled for breast cancer. So I know who had breast cancer and who was cancer-free when they collect the blood. And to train the algorithm, we showed to the machine complete blood counts of a woman that we knew that had breast cancer, and also of a woman that was cancer-free, and actually thousands and thousands of them. And after the training process, our model learns the statistical distribution that is more likely to each group. And now, when I see a new complete blood count, I can run it on my platform and provide the risk, the personalized risk for this woman to have breast cancer at this right moment. And as a result, we show that the women that we classify as higher risk have up to 3 times more risk than typical risk. Our product is business to business, focusing in health insurance companies in Brazil. And we estimate that they may save up to $50,000 per woman diagnosed earlier. This in Brazil. In the United States, this amount may go up to $100,000. And we are now working in the next milestones that will take us to the next level, which is commercialization. We have submitted a paper to Nature Scientific Reports, and it's in the final stages of approval, so fingers crossed so it can be published soon. We are also in the final stages of obtaining the equivalent of the Brazilian FDA, which is Anvisa, which we hope we get by June. And we are running our platform with proof of concept projects in 4 health insurance companies in Brazil, involving 30,000 lives. And in this proof of concepts, we have had access to preliminary results. In the first health insurance, we saw 3 times more women with breast cancer in the higher risk group. In the second one, we saw 2.5 more suspicious mammograms in the higher risk group. And in the third health insurance, we saw 3 women that were diagnosed with breast cancer in the higher risk, and this is 6 times more than expected as typical prevalence. And well, we welcome you to join our journey of making early cancer assessment accessible to all. Breast cancer is just the beginning of this journey. We are already building the largest platform in the world to support multi-cancer screening using artificial intelligence. So please reach out. I'm here with Vinicius, my partner and CEO of Runa. Thank you.
That was amazing, Daniella. Please take my blood.
Thank you, Jessica.
Well, I was very impressed, and so was the audience. So we have a few questions for you. Is that okay?
Okay.
Perfect. So tell me, how does your AI model perform compared to other cancer standard diagnostic detection?
Okay, so first, it's important to clarify that we don't aim to replace standard imaging examinations, such as the mammograms and the ultrasounds. These are the golden standard for breast cancer screening. They are really good at identifying cancer in early stages. The only problem is that they are not accessible to the majority of the population. So what we offer is a risk stratification tool that may organize the mammogram wait list or prioritize those women that are at higher risk. And having said that, This is hard to say. Yeah? Okay. Our method can be compared to the Tyrer-Cuzick, which is the most popular method for breast cancer screening. Our performance is slightly better. Our area under the curve is 65% and theirs is 61%. But our most significant advantage is that we use much more readily available data, which is only the complete blood count. The Tyrer-Cuzick needs breast density, number of relatives that have had breast cancer in the past, number of breast biopsies, BMI, and so on. These are data that are much more difficult to gather.
Wow, you've been talking a lot about breast cancer. How is it to adapt it for other cancers?
That's a very good question. Well, we have a methodology that is patented for using blood data to find cancer. So in the technological terms, it's quick. We could do it fast. But of course, to adapt it to other cancer, we need a very representative database of other cancer. For example, if we are going to colorectal cancer, then we would need blood tests from people that also underwent a colonoscopy and had benign results, and also people who went to a biopsy and had, as a result, a carcinoma. The good thing is that we have already established partnerships with very important health players in Brazil for multi-cancer detection. So these are our next steps.
Amazing. And could we use it in the US? Is it applicable? How do you need to change it?
Yes, definitely. To apply it to the US or to any other country, the first thing that we need to do is to check if the patterns that are applied for the Brazilian population are the same in the US. So it's very likely that it will be, because we have used data from different regions in Brazil with different heritages, such as European, African, and Middle Eastern. But we always need to check. But we don't need a very big database such as we needed for training. We need a small database to check if the results are the same, if the model generalizes. And if so, then we would need to go for FDA approval. And our strategy to accelerate this process is leverage the work we have done to obtain Anvisa, the clinical trial data, the documentations, and so on.
Oh, so which country do you plan to go next? And if it's the US, which is the next one? It would be
nice to be the US. Our focus now is mostly in Brazil. We haven't decided yet which country we should go next, but we have received some invitations from research institutions in Europe, but we haven't decided, so we are completely open for partnerships.
Oh. Well, that's the place to be. So coming back a little bit, why did you choose blood tests over more sophisticated data sources?
Blood tests are cheap, they are already working, and they can be scaled anywhere. And we are very used already to support the diagnosis of multiple diseases using blood biomarkers. The only thing is that we don't think that they are specific enough for complex diseases such as cancer. But this is because we are used to use only linear cutoffs. And using artificial intelligence, we can unlock these patterns in blood tests. So it's possible.
Oh, and considering that, what is the percentage of false negatives?
The percentage of false negatives, it depends a lot on the cutoff that we establish, because we are not a diagnostic tool. We show the risk of each class. We show a higher risk, a moderate risk, a typical risk, and a low risk. So depending on the cutoff, but giving the high risk, we can identify 15% of all cancers using only 5% of the mammograms.
Well, the numbers add up. So how challenging it is to obtain access to blood test data?
In Brazil, regarding health insurance companies, there are roughly two kinds of health insurances. The first one, they own the hospitals, they own the laboratories, and so it's really easy to get access to their data because they have access to the data. The second one is an insurance company. They just pay for the exam. So they don't have access to the blood data. In this case, what we are aiming to do is to partner directly with the laboratories that run their blood exams to get access to them.
Oh. And how do you compare your method to the 23andMe that is based also on DNA?
I don't think they are comparable because what 23andMe does is to find if you have a specific mutation, the BRCA1, the Angelina Jolie mutation. And if you have this mutation, you have 80% more risk than a person that doesn't have this mutation. But about only 5% of all cancers are due to this mutation. So it doesn't tell a lot.
Oh.
Yeah, we are looking at the CBC and seeing that your risk now, not your risk in the future.
Then, what is your business model?
We are B2B, focusing in health insurance companies, and we are not commercializing yet, just like I said, but we plan to do so in a subscription model, in a monthly subscription model, with range from $200 to $2,000 monthly per cancer. But we still have to refine this model. We are still working with it.
Okay, and where do you see Hona in 5 years?
That's a very good question. Maybe not in 5 years, but I think the future is that we will have continuous monitoring of our biomarkers, because they can tell everything about our health. So when this day comes, we are not going to get sick because we will know 3 days before that we will have a cold and there is a medicine that you can treat this cold, for example, or cancer. If you detect it in a very, very, very early stage, it's so easy to treat. It's only a surgery. You don't need chemotherapy. You don't need... So that's the future, continuous blood monitoring in maybe 10 years, okay?
Yeah, 10 years is fine. Well, that was amazing, Daniella. Thank you so much.
Thank you, Jessica. I'm very happy.